Hello, everyone, and welcome to Small Town Life. This is Dave Warner, and we're part of the Studio 25 podcast network. And usually I'm sitting either in a host chair or I'm back here producing, and you don't ever see this angle. But today we're doing something different. We've got a guest. We've got two guests in the studio here. So I'm going to start out. We've got Scott Kinville, who's normally filling a hosting spot, but today we're gonna bear down on his EMT and fireman status and make him answer a call.
Yeah, well, this is going to be quite the change, so I'll see how I do. Yeah.
It is. And then we've got Kelly Brown, who is the CFO of the Mohawk Valley Ambulance Corps, MOVAC, as everybody knows it around here. He's online. And then, of course, you can see on the screen here, we've got Senator Mark Walczyk. He's with the New York State District 49. And Senator, welcome to the show.
Thanks for having me. Great to be here.
Yeah. So the reason we're here is we've got everybody juiced up for emergency services is because there was a specific bill, I believe, that you sponsored or co-sponsored in the state Senate, and you got kind of fired up about it. So lead me through the process of this bill, why it came about, and what it was supposed to do.
Yeah, so I'm a prime co-sponsor of a bill. It's actually sponsored by Senator Shelley Mayer down in the Hudson Valley, and she's a member of the Democratic Conference. I'm an elected Republican, but this has a lot of bipartisan support. I'm what they call a co-prime sponsor. This is something that is critically important to the 49th Senate District and especially rural upstate communities. Basically, fire and police are essential services in the state of New York. What people might not realize is that ambulance services are not considered essential by law in the state of New York. So while you call 911 and you would expect an ambulance to be dispatched to your emergency, on the books, it's not an essential service. And that impacts the business of EMS in a number of ways. Additionally, New York State hasn't really taken a comprehensive approach to addressing emergency medical services and transport as a state. So taking a regional approach, and this is another angle that this bill presents, taking a regional approach so that each community, county, and area of the state are considering comprehensively what emergency medical services looks like is also very important to making sure that that service is essential. Finally, providing a funding line to make all of that work is another component of this bill. It's why it's been included in the Senate One House budget resolution in the past. Unfortunately, was taken out in the final budget this year. It's something that I brought up in debate, very disappointed that it didn't make it to the final budget bills. However, as a standalone bill, the bill that I co-sponsor did make it through the whole Senate unanimously this year. So not a single no vote. Obviously, senators from every area of New York State see that this is a critical need. Unfortunately, the bill didn't make it through the assembly. So still today, emergency medical services are considered non-essential in New York and don't have the things that I've just talked about.
So
I guess I'll start the conversation there.
Yeah. Okay. That's a good starting point. I mean, what is the problem in the House? And what was the vote? Was it overwhelmingly against, close? How did that go? Do you know?
No, it never came up for a vote in the New York State Assembly. I believe it got stuck in committee. And the reasons I'm not sure.
That would be like a critical thing to know. Like, why are they against this? What could possibly be the reasoning if you've got 100% support in the Senate?
Yeah.
What's the holdup, right?
Yeah, Dave, and honestly, I could make some guesses. There were past versions of this bill that included New York City. They have a little bit of a different situation, but the bill as it sits today is taking those things into account and actually carves out New York City. So cities in New York with a population over 1 million is how it's literally written in the bill, are exempt from any of the requirements here. So I'm really not sure why it didn't make its way through the assembly, but it's something that we absolutely have to continue to push.
Do you think it's a cost issue from their standpoint that they think it's gonna cost too much if they add EMTs kind of to the essential services mix?
There is some. So the budget resolution had a $20 million organization cost factor for this, which in the grand scheme of the state budget for a service that really, New Yorkers already consider essential because it is, to implement some organization and make sure that we're coordinating across the state so that every New Yorker is provided with emergency medical services. I don't know that that's the huge cost factor or prohibition there. I think that, however, with that much of a cost factor, you do have to get it done in the budget. So that was the big disappointment when it didn't, when it was discluded by the final budget.
Okay. And Kelly, from your standpoint, what does this mean to a private ambulance corps like yours?
There are so many things with EMS. EMS has always been the outcast of emergency services, right? Law enforcement, although they have their issues, separate from us, and fire, they are already considered those primary services, and they don't have some of the factors that we have. I think some of the things with EMS. So EMS is the only emergency service that really has a commercial point, and I think a lot of the folks mistake the commercial coverage and what that is, and maybe what the cost would be if they had to pay a commercial service. For us as a nonprofit, we're a nonprofit, and we have a very large territory. Our territory, if you know the area, starts somewhere along Mucky Run in Frankfort and goes all the way to Stratford, without the city of Little Falls, of course, and without the village of Ilion. But we cover pretty much everything in between. I mean, we're 400 square miles.
Yeah, that's a big run.
Yeah, it's a big area, and everybody is short help. Little Falls is always coming to help us. We've been coming into the city. We're going into Ilion. Everybody is responding to everybody else's issue, and part of this is this commercial base, which puts us all on the back burner. So I don't really know what the fix to that is. Only about 10% of the ambulances in the state are commercial services. 90% of them are either municipal or nonprofit, or there's even a small, very small state and federal component. The state has a few ambulances scattered around, but it's a very tough climb, I think. And I hate to say that. I salute the Senator for trying to get this through, because even during COVID, we weren't essential, but then told we were essential. And our folks, right? And our folks in the fire,
Yes.
our fire and EMS guys were the frontline people dealing with these COVID folks every day.
Yeah, that's true. They didn't make you stay home, did they?
No.
Well, not only that, you look, and I'm sure Kelly could back me up on this, the call volume has grown exponentially over the past few years. It's just skyrocketing. Of course, folks need the ambulance, but unfortunately, like we were just saying, there simply isn't enough personnel to go around to answer a lot of these calls. So people end up waiting 30, 40 minutes sometimes, but it's just a simple matter of shortage, and that's another thing that really needs to be looked at, is how do we incentivize people to want to go get their EMT, to want to go on to get their paramedic. Of course, money's a factor, naturally, but there's got to be ways and means to get that to the next level, whether that be through various tax credits or however we can do it. I mean, obviously the box is open. You got to look at everything, but that's another big factor, in that there's just so many calls right now and not enough people to go around.
Senator, have you looked at those kind of aspects? I know credentialing and all of that has been something that these guys have talked about, trying to ease up. There was a comparison to RNs and what's required for them versus getting your paramedic ALS kind of certification.
Sure. Look, you need qualified people at the same time, right? And I think that's kind of the evolution of EMS. I mean, we have the experts on the line here, so they could tell you more than I can. But EMS has come a very long way. It's no longer a taxi cab ride to the closest hospital. They're providing a lot of medical care on site and in transport to facilities. So the requirements to have, because the expectation of New Yorkers that you've got some professionals that have good training showing up on site. The qualifications really are high. I think that's the huge challenge with on the volunteer side. You get them trained up, and then they're going to seek a job. For the small paid contingent, they're kind of doing the same thing. They have a hard time with reimbursements, retaining staff, because they're looking for a more stable and higher paid job at a medical facility in a lot of cases. So it's a huge challenge across the whole industry.
Yeah. Kelly, how do you see the challenge from your standpoint?
Well, that is exactly what it is. Our medical director that works for MOVAC started out as a driver for MOVAC 20-something years ago. And many of our folks go on to become RNs, respiratory therapists. We have had several doctors. Everybody seems to want to move out of EMS for a number of reasons. And if I go back at the article that you sent that the senator wrote that talked about staffing, that study talked a lot about why people were getting out of EMS. And I do have the study, so maybe we'll talk about a couple of those things.
Yeah, sure.
If you don't mind. One of them, of course,
Kelly's got to whip out the book, Senator. Watch out.
As was already mentioned, was the monetary standpoint. It's really the lowest paid of the emergency services, although we do see that changing. They didn't used to offer things like retirement and benefits. That's also changing, even with us. So we started out 100% volunteer in 1979. And I'm sorry to say, I was around.
You were there.
I was around then.
I'll zoom in on you here so we can just see the age.
It's a bald spot in the white hair. That gives it away. But here's a couple of the other things. 85% of the respondents for that study that the senator was talking about, 85% of the respondents experienced burnout or compassion fatigue is what they called it. And 89% of the respondents experienced a traumatic event or incident while working with EMS. The problem with a lot of this small town stuff, and this is where we are, when you go to a call, it's either going to be a family member or a friend, because everyone knows everyone. And that makes the job that much more stressful.
Wow. So how do you, this bill that the senator is talking about, how does it impact those items? Because those don't seem related to kind of what was trying to happen up there at the state level. How does it fix that?
Well, I think maybe if it becomes an essential service, we tie some more money to it, and as we get a little better, the problem is the staffing. If we have more staffing, you do less call volume.
Okay.
Right now we have people literally running back-to-back calls for 24 hours straight. And they're lucky if they get a rest if they're on a 24-hour shift.
Wow.
So if you're able to put another crew or two or three on, now you're at least lessening. And if it's an address that comes in that you can send another crew. Hey, that's my friend, that's my family. I really don't want to do that. There's a number of ways it certainly could help.
Well, yeah, the 24-hour shifts are rough. I can speak from personal experience being up for 18, 19 hours straight, and then all of a sudden you get that call that comes in at 4 o'clock in the morning, somebody's having a heart attack. Well, you got to try to think clearly after being up for 19 hours straight running calls, and now you got this major call on your hands. So, yeah, I do think that the staffing would certainly be a major start to help fix this problem. But I also think, too, that, a lot of it's just coming down to the municipalities, and in your case, the private organizations that are running this. So I think that at some point we really have to change the model here and how we're doing things. I think the counties need to be more involved with it. I think that, county-run services are to me, are the future. They can, provide that many more resources. Even say, like we were talking about earlier, like how do you incentivize people to come aboard, right? Health insurance is a huge thing nowadays. It used to be 15, 20 years ago, it was cheap, right? Now it's through the roof, and that is a major strain on municipalities, private organizations. If you can get any kind of help in that regard, that's a great recruiting tool, right? Even if you have somebody who will say, well, I'll work part-time, say 20, 25 hours a week. I'm just throwing numbers out there. I'm not giving any exacts. But say, we can't pay you that great, but we'll provide you with health insurance at a very affordable cost. You know what? To somebody who's, say in their 30s, 40s, 50s,
keep going. I was going to say, keep going, Scott.
Yeah, that's a huge incentive. That really is. And so we really need to start looking at different ways than what we've been doing in the past, because the past is the past and the future is the future. Yeah. And things have changed that much dramatically I started in this 22 years ago as a volunteer at MOVAC and in Mohawk Fire Department. And how the landscape has changed from that time is incredible. So really, I think that we need to get more voices in the room, more people at the table to start discussing how we're going to fix this.
But, I'm going to disagree with that county thing, because that puts me out of business.
Well, and he's gonna have the mayor on his butt too. So,
but again, we're talking about costs overall to everybody, and we need to start talking, even if they don't take over, have something to do with it, because something has got to, or
even a level of funding.
Exactly, that's where I'm going with this. That something has got to give, because let's face it, municipalities are strapped nowadays. I don't think you can look around and see a municipality, not up here anyway, or say, we're in wonderful shape. We can put on 3 or 4 more ambulances, no problem. You don't see that.
You do. Illy and John Stevens, that's what he says, right?
Yeah, and I can tell you right now, he's wrong.
Oh, geez. Yeah. Here goes the controversy.
Yeah, that's Senator, okay. I went to school.
I know.
Keep me out of this part of the conversation.
You want to weigh in on that, Senator? No.
Is it time for a commercial break, by the way? I just wanted to know.
Yeah, we can. Anyway, have there been any discussions in Albany about some of these details that the guys are bringing up here?
Absolutely. Actually, towards the end of session, we passed a bill that would require municipalities to have an emergency plan. This is one of the provisions that's in the bill that we've been discussing here, the emergency services bill. It's a good first step, and I think, there doesn't need to be an attack on municipal or an attack on volunteer or an attack on privately run ambulances. There just needs to be good coordination and a good plan. I don't always love it. In fact, most of the time, I really dislike it when the state comes down with their plan and says, this is how you should do things in upstate New York. I get pretty sensitive to that type of legislation. But it's pretty clear in the area of emergency medical services that we need some really good planning and some really good coordination, and that has to be led from the bottom up. So from Little Falls and Herkimer County, sending it up to the state and coordinating with a regional plan for ambulance to make sure that everybody is covered, and that all of the voices are heard. And that New Yorkers, when they dial 911, they're expecting an ambulance to show up when they're in a tight spot. And I'm sure, without fear mongering, I'm sure we could tell plenty of stories. I know I've heard them from providers where they're so short staffed that it's really difficult to provide some of the basic medical care that they expect in their coverage area and that people expect when they need those services. And that's why it's so. That's why I became a prime sponsor of the bill. It's literally life and death for New Yorkers in the area that I represent.
Yeah. Kelly, go ahead, Kelly.
But there is a point to add to that. It isn't just the staffing. So one of the other issues is, now Little Falls Ambulance Service being in the city and having a hospital in the city, right? All right, they have at least the opportunities of quicker turnaround, the call volume, they don't. So remember, we used to have a Herkimer Hospital in Mohawk Valley General Alien as well, which made a lot easier turnover. Now you have these issues. Like we go to Wynn. I had a crew stuck at Wynn Hospital the other day in the emergency room with a patient on the stretcher, 6 hours.
Oh, wow.
Yeah. 6 hours. And they had 14 ambulances lined up there.
Oh, that's crazy.
Okay, so as we have shrunk the healthcare system a bit, that has also affected ambulance service because it gives us longer turnover times. We have. It's not uncommon if I get a call at Stratford that goes to Cooperstown to have a 4 or 5 hour turnaround, and the actual money you make on a call is less than zero. You lose money on those.
Right. And speaking of money, reimbursements is part of this this problem, right?
That's got to be addressed.
Absolutely.
Got to be addressed.
Scott, who wants to lead on that one?
I'll let you, Kelly, you're the CFO, so I'll let you.
I'll just say this. Whatever is usually billed on, I think it's pretty typical of the ambulances. We get roughly 30 cents on the dollar. So when you hear folks say, how come my bill was $1,000? It's because we're going to get $300. And when you look at the cost of ambulances, let's just say we look at the cost of ambulances. A brand new modular is now anywhere between $220,000 and $250,000. A van type they're up to $160,000 roughly, and I know I just bought 3.
How many vehicles have you got at MOVAC?
We took delivery of our first one. Once the other 2 come in, we will have 10 ambulances plus an ALS response vehicle, a flight car.
Okay.
And some other stuff.
I wanted Senator to know if he wasn't aware of how many vehicles you've got running there.
The problem is I have 10 ambulances. I can staff 2.
Right.
Which we would love to be able to staff them all. We wouldn't have these issues, but you can't find people.
Yeah.
So
sure,
we get roughly 30 cents. That's the bottom line.
And Kelly, when you say that 30 cents reimbursement, would you explain to people what that represents? You get reimbursed by mile, right?
An ambulance call always has a base charge, whether it's a basic life support call, I broke a leg or cut a finger, whatever. Yep. And then there is a so much per mile fee.
So then as you were talking about waiting in an emergency room, there's nothing that you can bill for that time. That's just right out of your
that's all
that's right out of your hours, and that's right out of your mileage. You're not running that ambulance if you're stuck at an ER department somewhere.
That's correct. That's why you see now we talked about the commercial aspect. I'll just do it quick because I want everybody to the commercial services you only see them in big metropolitan areas, right? You remember an ambulance service called Rural Metro. It was around a while ago. Rural Metro used to be the largest ambulance service in the world. I worked for them. I was a medic for them for years. They were in almost all of the U.S. and 6 other countries. They were in Canada. They were in South America. They were everywhere. And when they were and they were actually initially a paid fire department. That's how they started. That's how they actually started. They were Scottsdale's paid fire department.
Wow.
Yep.
But when they started getting into the rural part of Rural Metro, they bankrupted themselves.
Because you can't make the money here.
There is no money in rural.
And we have to be honest and say, with upstate, I'm sure everywhere else too, you're heavily dependent on Medicare, Medicaid. That's a big component in it, right? And we were only talking about transport calls. We weren't even talking about the lift assist that we have to go out and do, which we'll gladly go out and help pick somebody up. That's not an issue, but it still adds your call volume. The patient refusals. People decide, I just don't want to go. Hey, that's, again, you're not transporting, but it's still time that you have to address to the issue. And we were talking about the different hospitals, Little Falls, Wind, all that. There's a lot more transfers out there now, too, because as the healthcare system itself shrinks, people still have to go somewhere, right? And if you end up taking a patient to, say, Little Falls Hospital, and they do their workup and they go, oh, boy, this is a little bit more than we can handle, that patient's got to be transported by ambulance to be in this area, either a Wynn or a Cooperstown, or in some cases, Albany, Syracuse, wherever it is. But still, that requires an ambulance to do so. So that adds to your call volume. So again, there's so many different components to all of this that it's going to take a real big table to get people together, to get everybody's input too. Because I think sometimes, and it's not just EMS, I think in a lot of things and generally in life, we tend to start looking at things through the same scope all the time. And you have to start broadening the horizons a little bit, so to speak, so that maybe, I didn't think about that. Let's discuss this a little bit more. So, again, I'm only the guy just sitting in a chair here talking.
Well, no, one of the things I wanted to bring up to you, Scott, was how have the type of calls changed over the years, say in the last 20 years. What did you normally get 20 years ago? And now, it's radically changed, correct?
You know what? I don't know so much if it's the type of calls, it's the requirements for the calls.
Okay.
It used to be years ago, 20 years ago. ALS was still, and Kelly, I'm sure, it was kind of in its infancy, so to speak. We were still kind of working our way through what can we do. Well, now you got 20 years later, and you have all this new technology and this new medical knowledge that's out there that is wonderful for patient care, but you have to get people trained up to do these things, right? There's so much more that you can do. And so with that, again, it comes back to costs. It costs to train these people. It costs to get some of these equipments. Like, remember the original cardiac monitors were just a little tiny screen that had one line going across it, right?
My first monitor was about the size of this table. It was an old, it was a verdict. It took 4 guys to carry it. And, it was,
you needed a hoist.
it was really bad.
But now these monitors today are incredible. They do the 12 lead EKGs. They can do the CO2 monitoring. They can do, obviously defibrillation, pacing, cardioversion. There's so many different things you can do. But again, you don't just read an article and say, "Oh, I can do that."
But hasn't that equipment kind of required you to have a different set of skills on the ambulance itself when you're doing a transfer?
Well, because you have to be a paramedic to be able to do all those.
Right.
And a paramedic requires, don't get me wrong. Hey, my hat's off to anybody who wants to get in this field, because even becoming a basic EMT is still 6 months of classroom, and you still have to make that commitment. To become a paramedic, you're talking about a year now. And you're talking usually 2 to 3 days a week in the classroom. And then you start getting into what they call ride time. You have to ride with another ambulance provider. And that's up to over 100 hours of that. You have clinical time. You have to go to all these different hospitals, and you have to do all these different skills. So what you're asking people to do is to really be married to being in the paramedic program for a year. And when I did it, your family kind of goes on the back burner. It's just, it's unfortunate. It's something that happens. If you really want to do that, that's what you have to do. But with that said, with these people being expected to do all this, well, where's their pay? Where is it? Because that is a really legitimate life-saving skill that they're learning. And I know, just the different disparities in pay between EMS and say RNs working in the ER is incredible. It's like this, right? So, there's that, and that's where I kind of think the state could come in and help too with the funding to help boost the pay for these people that are willing to do that.
Yeah, Senator, any kind of thoughts on that? We've got plenty of info coming your way if you haven't heard it before.
Yeah, absolutely. No, and great conversation. I'm taking notes because these guys are bringing a lot to the table and things that I need to continue to pay attention to. I think overall, the point that I made up front about having more and more requirements as this being a critical component of our healthcare system were illustrated in Scott's last point there, that the requirements are a lot more on the ambulance services. And when the requirements are a lot more, hospitals are expecting a lot more of those services in what they're doing with patients prior to their arrival. And, for us to still consider them non-essential and transportation-based. And then, if I was going to go back, Scott, what happens when someone refuses to be transported when you're called? What's your reimbursement look like for that?
I know from our end, it's nothing, zero.
Yeah, if you do not transport them or treat them in some way, there is nothing.
There's no reimbursement.
That's just a tie-up. It's a zero.
So I think that's key. We've already illustrated a number of the ways that while we're considering this an essential service, they are really hamstrung. And I think it was Kelly briefly pointed out reimbursement rates from Medicaid, especially, and also Medicare, fall way below where it is to sustain the services that we expect. So really, the state and the federal government have to step up if we want to continue to see good rural healthcare services in EMS, which I certainly do. We've got to step up and make sure that those reimbursement rates are appropriate.
I want to kind of go around the table and see if there's, Kelly, I'm going to start with you. What is the biggest thing you need right now from the senator, from the state, in your thinking?
Well, that's really a tough question. It seems like they're trying to make the strides in the right way. It needs to be known, these things, that EMS is just not, that we really are outcasted. Nobody thinks about ambulance. Even when you're listening to, we're celebrating the first responders, the police and the firemen. You never, ever do you hear them mention EMS personnel. Very, very rarely.
I don't think people know the difference? I mean, you've got firemen, you've got police running
that's
around,
correct.
first responders kind of thing, and everybody's in that same bucket, I think.
And
is
a lot
the
of
way it goes.
municipal folks, it's both. I mean, you
Right,
are
right.
fire and EMS,
Little Falls.
which is why
Little
you
Falls,
don't
yeah.
get
Yep.
that separation.
Alien as well.
It used to be much better known, actually, I think, when there were more volunteers. I think it's really the death of the volunteer that has hurt rural services the most. You won't find very many 100% volunteer services anymore. They'll either be a hybrid like we started out to be, or they'll become fully paid like we are. I mean, when I go back to when I took my first medic class in the early 90s, I was in Joe Taylor's class.
That's a legend right there.
There's a guy who drove himself to the hospital when he was having a heart attack.
Yep.
Oh, shit. Really? He really did?
He put his own IV in, put a heart monitor on, drove himself in his own flight car.
Oh my God.
That's a legend. There's
There's a story for you to take to the floor there,
Wow.
Senator.
There's a guy. But back then, as we spoke of before, the requirements were much lower, right? Becoming a basic EMT was nothing. I mean, a first responder class was a couple of months on Saturdays for
That was
4
it.
hours. An EMT class was a few months, maybe 3 or 4 months. That was a couple days a week, so it was a little more intense. Very little ride time, no clinical time. That wasn't heard of back then.
Correct.
The medic class, even when I took it, was maybe 8 months. It was intense, and we did do some clinical time. We did have to do ride time. I had to go to New York City to do mine, and they told me I had to provide my own flak jackets and body armor when I went down to do it. Right? Anybody in a uniform.
Wow.
But anyway, so the requirements are longer. Then to keep the requirements, the continuous training is more of a drag. You have people working more hours now. They didn't have to back then. You have two working people in the family.
Yes.
Nobody to be with the kids. The kids are doing more things. I mean, there wasn't 54 things to do when I was a kid. There was 2: go outside or go inside. Right. I mean,
With our 2 channels on the television,
that
right?
was it, right? Yeah, it was my father's remote.
They
That's
didn't
what I
have
was.
television back then when Kelly was a kid.
Yeah, I was my father's remote control. That's what I was. But so all of those things have added to make it very difficult for folks to volunteer. It's really rare to find a full volunteer service anymore. And if they are still full on volunteer, let's say like Cedarville, okay, they don't cover too many calls. They might catch one here and there, and they do the best they can. They're great folks. Love them.
Yep.
And they always come to help. If they end up calling us, somebody still comes. But the volunteers, they just don't have that time.
Yeah.
And I think that's a general too. I mean, not just EMS or volunteering, anything. It
Yeah.
has really gone downhill. I mean, it's just the way it is.
Yeah. From your standpoint, though, Scott,
So-
what would be the biggest thing here for the senator?
So anybody who listens to, say, Herkimer County Dispatch for 12 hours would know it's staffing, right? You just hear that those tones going constantly. The biggest question and what we've been talking about here is how do you address that? What are some of the different ways to do this? We've been talking about, the requirements that folks have to the time away to go take a paramedic class or to take an EMT class. Personally, I mean, I've always been old school, classroom, I got to be able, but let's face it, online's a huge thing now. You can get an entire 4-year degree online. So maybe if we can start incorporating online classes somehow, some way into some of this training so that maybe folks don't have to travel 30 miles to a classroom, 2-3 days a week to take their classes. I think that would help because they did a lot of that during COVID.
So none of
They were
this,
still
none
doing
of this is
paramedic class.
online for any of it?
Now, your research can be, but not actually getting the class.
Really?
It's all in person.
Original classes, yeah.
Wow.
It's all in person. So, there's that. Again, we talk about funding. Where's the funding going to come from? Because obviously the reimbursement is not there. Not enough to sustain the service. The reimbursement or the funding has to come from somewhere else as well. Certainly to make up the difference as to what we're not collecting on reimbursement. And I think that, recruiting's a big part of it. I'm 51 years old. I'm not good with TikTok or anything like that. But, for a younger person, if you can come up with different ways to try to recruit them in. But again, staffing, and as it always is with everything else in this world, the almighty dollar rules. Yeah.
Yep.
And trying to create enough income or cash flow to get these services off the ground and to organize it so that we're not going through this shuffle every 5 years of, this one's responsible for that. I think we have to really start centralizing what we're doing here. And we have to take a good hard look at ourselves and say, okay, we can cover this. We can cover this. Let's be realistic here and break it all down so that an agency like MOVAC isn't covering 400 square miles, right? It's got to be broke down a little bit into manageable pieces because everybody knows, you can love having a pizza for dinner, but how do you feel after you eat the whole thing? Not so good, right? So
where did you come up with that one?
I wouldn't mind doing that if I could get the staff to do it.
Yeah. Right, but there it is. It's staffing, right?
So all staffing.
Yep. To me, it's definitely staffing, and how do you get these folks to attain the higher levels of care that's needed?
Well, Senator, we gave you a lot of feedback.
Yeah, tons.
What do you
great notes here.
What do you think the next steps are from your standpoint?
Well, right now we've been dismissed from legislative session, so we're in recess. We officially go back in January. We could always be called back to another special session, but I think we've got to really dig in and find out why that bill didn't pass the assembly. And then I would say the advocacy from anybody who is interested in this, who wants to see EMS as an essential service in New York, which I think is a critical component to how we move forward here with a regional approach, with feedback from locals, with reimbursement increases to make sure that all ambulance services are getting the support that they need, and then we can provide staffing and hopefully retention for staff as well. And help against some of those burnout statistics that we talked about earlier. Any of that advocacy towards the assembly or towards the governor's office, and ultimately the governor's office, because I think there's a very important budget component here. The governor will be building her budget this fall and presenting that to the legislature in January, February timeframe. So I know it's easy in the summer to get mixed up and go out and have some fun. But especially in the fall when we're advocating for state funding, that's the real time to do it as the governor's building her budget. So that's what I'm going to be focused on, that and a bunch of notes here. Everything from health insurance to volunteer and online training for EMTs. I thought there were some great notes. So I appreciate the conversation.
Well, I think you're going to be in Little Falls, and maybe we can get you and Scott together to put that TikTok video up.
Of course, I'll be in Little Falls.
I will gladly meet with the senator. I don't know about TikTok, and I don't know about that. So.
I'll be behind the camera with you.
Yeah, we don't want to depress recruiting with you guys.
Yeah, no. We want to bring people in, not scare them away. Right?
Well, Senator, I really appreciate your time today. It was awesome that you took the time to listen to this. I know you think it's an important bill, and maybe there's a way you can craft it differently, or maybe even chunk it. Go at it a piece at a time, and maybe get less resistance that way. I don't know. What do you think?
Yeah, whatever it takes to get it done. I did mention we got a small piece of that done at the end of the legislative session, but there's definitely a lot more work to do here.
Right. Awesome. Well, I want to thank you for your time, everyone, both of you as well.
Thank you.
And we'll see you next time on Small Town Life.